A woman can become hypertensive when she is pregnant in a condition called preeclampsia, and this hypertension can persist even after delivery, making this woman hypertensive for life. So today we're going to be talking about preeclampsia. What is preeclampsia all about? What are the causes of preeclampsia? What can increase a woman's risk of having preeclampsia? So stay tuned and listen to more. You're all welcome to Talk Pregnancy with Dr. Noela, where we tell you all about pregnancy and other women-related health issues. So today we're going to be talking about preeclampsia. So if you're new to our channel, please click the subscription button. And to those who have subscribed before, thank you very much. I love you. So what is preeclampsia all about? What are the causes of preeclampsia? What can increase a woman's risk of having preeclampsia? So preeclampsia is a dangerous condition during pregnancy, which occurs when a woman's blood pressure increases during pregnancy to above 140 or 90 millimeters of mercury. This usually occurs after 20 weeks of pregnancy. That's about 4 to 5 months of pregnancy. So what causes preeclampsia? The cause of preeclampsia is quite unknown, but there are some women who are at risk of having preeclampsia than other women. These women have a higher chance of developing preeclampsia than other women. So the first risk factor is if you have had preeclampsia before, you have a higher chance of having it for the second baby. If you are hypertensive, so this woman already has high blood pressure before and she gets pregnant, she's at high chance of having preeclampsia, eclampsia. If this is your first pregnancy, you have a high risk of developing preeclampsia. If you have diabetes before even getting pregnant, you have a high risk. Women who deliver, who get their first pregnancy less than 20 years of age and above 35 years of age are at high risk of having preeclampsia than other women. Also, if you're carrying a pregnancy which is twins or triplets, you're at higher risk. If you're also obese, and it's always good for us to know our body mass index, where you can calculate and know whether you're normal weight, you're overweight, or you're obese. So women who are obese have a higher chance of developing preeclampsia. So now, how does it come about? It happens at the level of the placenta, where when the placenta comes and attach at the level of the womb, it does not penetrate properly into the womb. Once it does not penetrate properly and it does not create the right blood vessels at that level, what happens is that it causes a high pressure at the level of the placenta when it is attaching. So we have a problem at the level of the attachment. So once this attachment does not occur properly, it increases the blood pressure at that level. And therefore, once it increases that blood pressure at that level, it increases even the blood pressure in the woman. So there is a form of resistance. It's almost in a way like the body does not want to accept this placenta attachment. So that's what actually caused the preeclampsia. So now, how can a woman know she is having signs and symptoms of preeclampsia? So the most common symptoms is headache, severe headaches. So you might just have light headaches during your pregnancy, but when these headaches tend to persist, so in this case, just start thinking of preeclampsia and think the first thing is to seek a doctor's opinion immediately. When you start having changes in your vision, be it a little bit blurry, or when you start seeing lights and it starts affecting your eyes, start thinking of preeclampsia. When a woman is pregnant, normally there are some stages where there's increased frequency of urination. You see that the rate of urination has decreased, so she starts producing less urine. You start thinking of that. In severe cases, we can have swollen faces, swollen hands, swollen legs. So these are severe cases. Once you start having these signs, you should report to the nearest health facility. Even some cases of severe nausea and vomiting. These are also signs of preeclampsia. The main symptoms where women will tend to miss is the pain at the level of the upper belly. That's where most of the times you'll be thinking of gastric. Most women say they have gastric most, and when it is after 20 weeks of pregnancy, when you start having severe upper belly pain. Once you start having that pain and it is increasing, that is already a serious sign of preeclampsia. You can start convulsing at any moment, so you better go to the hospital and be checked. And once you're checked, they'll check your blood pressure. If it is normal, they check your urine. If it is normal, then maybe we can conclude it is just a normal gastric. But once you start feeling this and it tends to increase, and even associated maybe with one or two of the other symptoms, please report immediately to the hospital. These are eminent signs of preeclampsia. So, and in any point you can start convulsing leading into eclampsia. So once you start convulsing, you can go unconscious, and this where people even lost their lives. They reach while they're convulsing, and by the time you want to even go and do a cesarean section, maybe the baby is dead and you've reached into a serious depreciating condition where it has affected maybe your liver already, your kidneys already. And these are the most common. Once it has reached this stage, it is very difficult to reverse. So it's very important, once you start feeling these symptoms, please report immediately to the hospital. So this is why it's very important for us to attend antenatal clinics. This is where your blood pressure is always checked, your weight is always checked, because massive increase of weight too can also be a sign and symptoms of preeclampsia. So all these are checked during your antenatal consultation. If your blood pressure is a bit high, what do? Here is the management of preeclampsia. You are put on drugs, you are put on medications to reduce the blood pressure. And once you are put on this medication, you should not stop the medicine. You should not stop till your doctor advises you to stop. You know, many of us will say, no, let's use traditional herbs, let's use this, and I cannot be hypertensive at this moment, I cannot do this. So once you're put on drugs, you take them every day till you are stopped by the doctor. So normally, after delivery, your blood pressure and all these signs of preeclampsia should go back, should resolve. So you should not be hypertensive, since it is at the level of the placenta attaching to the womb, which is causing this high blood pressure. After delivery, definitely everything should go on normally. But what happens in cases where this hypertension persists in women? What happens? The first reason is, after this, they stop taking their medications. They know that they cannot be hypertensive. They just believe that no, because once the blood pressure has gone down, they might put you on some medications for a while, reducing the dosage till it finally stops. But what happens is, women, once they have left the hospital, they don't come for follow-up, and at the end, they stop taking the medications, and when the blood pressure has to rise again, it rises in a way that in order to control it, you need to be on medications even for life. Some go and start mixing it with traditional herbs. Some go and they don't also continue with the lifestyle modifications, because the first thing is, once you're on the medications, there are also additional lifestyle modifications technique in which you have to follow through, which is decrease your salt intake, you stop Maggi, moderate exercises, and regular checkup. So in women, once you have had 1 or 2 weeks after, this blood pressure can go back normally down, can go totally down with no problem, and you live without medications. But once you stop taking the medications, when they have not dropped it totally and stop you, or your doctor has not stopped the medication and do a complete follow-up, once you stop on your own and it comes back very severe in such a way that you become hypertensive for life. So there are some women who are out there who have had hypertension at their age for life, and they are on medications already, taking it for life. which is not a good situation. So if we can practice this, we take our medications regularly, we do regular checkups, and we do our lifestyle modifications after delivery. This will prevent us from having a persistent hypertension after delivery. So if this was helpful to you, please click the like button. And also, if you want a private consultation or a private chat with us, you can click the link below and book for a consultation. Thank you very much.